mind body math. And so tell us what people should look for in their own sleep patterns to detect problems.
Sure, absolutely. And thank you. Yes, we all play a vital role in health, and hygienists are placed in a very unique position. So I do agree with the ability in the microbiome. And that's a whole other topic just on oral health. But some of the things that people might not realize that they're experiencing could be things like anxiety, irritability. You could be grinding your teeth. So a dentist or a hygienist would pick up on the wear on your teeth. You could have those bony growths in your mouth that when you get your x-rays taken, it kind of hurts to bite down on. You could have dry mouth, cavities and gum disease, despite having good oral hygiene practices and a nice healthy diet. You could have digestive distress, like unexplainable IBS symptoms, constant colds, flus, and then the things that are really starting to show up as you age and you experience snoring longer would be high blood pressure, poor memory, right? Because those things are coming as a response to not having the proper oxygenation to our brain and to the cells in our body. So those, I think, are the many, many different aspects that snoring could be contributing to, or it could be the root cause of.